I want this class today to be the most fundamental work that you can do for yourself for low back pain. Show you how to position the pelvis along with the legs and the spine so that you can apply that to moving around in the world. Because a lot of us hold ourselves on a day-to-day basis in strange ways that causes the lower back to hurt. That's kind of the basic way I can put it. We all have different body types and different habits, and so that affects over time how we feel. I'm using these two stools and I'm going to put a bolster on top of it. What I'm trying to do is give you some idea of this height would be kind of like a countertop height. This is too short. So I'm setting up this bolster and this blanket. So it's a little bit at hip height. It's just a little lower than my hip height. That comes right across basically my center abdomen. Set this up on a table at your house. Point your second toe straight forward.
The second toe aligns with the mat and the center heel.
Then you press down, you lift up through the abdomen. You see I'm standing pretty darn close. Lengthen the front body and come forward. And you can just turn your head then from side to side. You can put a blanket here for your head if you want. And I let myself relax onto that support. Now, my frontal hip points, these bones in the front of your hips, they are supported. They are on that lift. The flesh of the buttock is going that way, and I press my heels down. And I just kind of rest there for a little bit. Now, everybody feels different things in these poses. So I can't say, oh, you're going to feel this or you're going to feel that. But I can report what I feel. I feel just a little like a stretch right here in my low back. And it feels really good. And I just relax and let that happen. You can see there's no big arch here. This is all pretty well straight and even. Breathe in and out through your nose a little bit. Feel that. You spread your toes and lift through your kneecaps.
Watch how the kneecaps shrug up right there. That's what you want.
Then use your hands.
As you begin to press down on the bolster, also press down with your heels.
Push that lift away and come all the way up to standing. Now we're going to bring your mat to a wall. So bring the narrow side of your mat to be flush with a wall. You don't need the whole wall. It's basically the baseboard is what we're looking for here. Then you're going to lie down on your back. But now watch how I lie back. I'm going to stay fairly close to the wall, be in the middle of my mat, lie back, so that when I put my feet against the wall, my legs are not straight at first. But I'm going to push my heels into the wall, and as a result, my body is going to go back towards my prop wall back there. Please do not wiggle and bring yourself back. That defeats the purpose. Instead, watch, I'm lifting my head. You can lift your head. But I push with my heels, I push with my heels, and the body goes that way. But the clothes and the flesh on my back body are pulled towards the wall. You might even see how my pants, the back of my pants, look like they're being pulled down. It's okay. No one can see them. No one's standing behind me. You can see what's happening, and that's good. You need to. That also, by the way, is happening in my shoulders and in my shoulder blade region. That skin is being pulled down the back. If you don't get that, you bend your knees and you do it again. You see where my low back is. It is not way up away from the floor. It is close to the ground. So you want to be able to feel that lengthening going on there as time goes by.
That length that you make in your lower back makes room for space and change.
Heels push. Keep that length Now I'm going to spread the bounds of my foot from the big toe to the small toe. I spread the mounds of the foot against the wall. And I want that region to press the wall as well. Now when that happens, my kneecaps pull up towards my thighs and my front thighs press down towards the ground.
The heels push the wall, then the mounds of the toes spread.
Keep that length. Reach your arms up, hold your elbows, and slowly inhale, pull the arms overhead, but keep the heels pushing the wall. Keep the mounds of the foot spreading against the wall. Your side waist stays down or back, however you want to think of that, towards the ground. The trunk stays where it is. You keep your heels, the mounds of the foot, legs active and strong as you pull the arms overhead. Then you change sides.
The back ribs lift up towards the shoulders and away from the back waist, creating more and more space in the lumbar.
And then keep your left leg, hug your right shin bone in. So just interlock the fingers and pull in towards you. Now, if you can't quite reach that, take a towel or something, like a hand towel, wrap it around and pull. That works fine. But as you pull the right leg in towards you, relax the right leg, but make the left leg more active. Heel away, mounds of the foot away, like you're standing on that left foot on the ground. Breathe in and out through your nose. Then set the right foot down, extend it to the wall, and notice how you're suddenly further away from the wall. And you have to kind of start over. Heels against the wall. Spread the mounds of the foot. Now left leg comes in. Same thing, just relax the left leg. Let it come closer and closer. The left leg is the passive leg now. Your right leg is the active leg. Heel to wall, spread the mound of the foot as well. So there's two separate actions, two separate efforts in that right leg. Heel and mound of the foot. Equally important there. And then release that left leg. You're going to want to have some sort of strap. Make a loop in your strap. It doesn't have to be a short loop. Just make it sort of something like that. When you lie back again in the exact same way, every time, start over. Push the heels, get that length in the low back. Spread the mounds of the foot. Feel how it lifts your kneecaps and takes the thighs down towards the mat. Then you hug your right leg in again. Take time with hugging that leg in. Stand in your left leg. Now, take your strap. You have this loop, right? You see it's like I'm holding on to either side of the loop. I'm putting both sides of the loop around my right foot, and now I have handles, and I can straighten my right leg. You can bend your elbows. You want this leg to try and be a 90 degree at your hip. So your right leg a 90 degree from the floor. Then just stand, push up through the right heel. Keep standing on that left leg against the wall. Hook the strap right above your heel bone. Then press the mound of your right foot to the ceiling. You see, it's not my toes, it's the mound. Breathe in and out through the nose. Put both sides of the strap in your left hand. Put your right thumb in your right hip crease, right there at the top of the right thigh. Push that towards the wall. Now you'll notice, when you push that right outer thigh, hip towards the wall, your left thigh wants to lift away from the floor. So stand again in the left leg, make that left thigh bone descend. Relax the abdomen. Breathe into the sides of the body, the side ribs.
Working with the two legs asymmetrically in this way makes space in the low back.
Then both hands hold the strap again. Now you find out, can you get this part of your body to move without your hand pushing it? Then bend that leg, hug the leg in again. and straighten the right leg on the floor. Move into the wall if you need to regain that traction in the low back buttock region. And by the way, if you need a pillow behind your head, just have it. It's no big deal. If the chin lifts a lot, you should have it. Hug your left leg in. Stand more deeply in the right leg. Right leg's your active leg now. Heel hits the wall. Then spread the mound of the foot into the wall. Keep the right thigh descending and straight. Then hold the strap. Both sides of the strap around your left foot just above the heel, straighten the left leg. So now, again, you're standing in the right leg, push up through your left heel, then spread the mound of the left foot towards the ceiling. You need for your left leg to become straight. If the hamstrings are tight, the foot might be further away from you. That's okay. As long as you have the strap, you just open it up to make a longer strap. If your hamstrings are quite tight, you might need a strap like that. That's okay too. Okay, so it might be something like this. You just have to accommodate your leg. But here's the important part. The leg needs to be straight. That means your kneecap shrugs up towards your thigh. Then put both sides of the strap in your right hand, left thumb in the outer left hip, push that hip towards the wall, and stand into the right foot. That's against the wall. Let the abdomen relax. Breathe in and out through the nose. Feel the breath can expand into the side ribs. And then bend your left leg and hug the leg in. And release the left leg out to straight. Now let's do that one more time. Right leg hugs in, stand in your left leg, hug the right leg in deeply. Then take the strap, hook it around your right foot just above the heel, straighten the right leg to a 90 degree as much as possible. Right heel pushes up, press the mound of the right foot up. Take the straps into your left hand, right thumb pushes that right hip away. Stand in the left leg, breathe.
Over time and with practice, your outer hip will be able to move without your thumb there to assist it.
Both hands back onto the strap. Bend your right leg, hug that leg in. Keep standing in the left leg. Change sides. Notice each time I reconnect to the wall. Hug the left leg in, stand in your right leg. Hook the left foot just above the heel, straighten the left leg, make it straight, spread the mound of the left foot, stand in your right leg. Put the straps, both sides in your right hand, put the left thumb in the outer left hip crease, push towards the wall, but stand in your right leg. Relax the abdomen, allow for the space that can come into the lower back here. So in other words, don't fight the work, but relax into that space, right? And then release the left leg, hug it in. Release the strap, straighten both legs one last time. And then bend your knees, roll yourself onto the right hand side, use your left hand, push the floor away, look down to come up. All right, so now we're going to come up to standing for a moment. So when you do, I want to do this right away since we just did that against the floor. When you stand up, I want you to look around your space there and see if you have a corner in your room. What I mean by that is, well, there's two kinds of corners, right? There's a corner where two walls meet where it's concave like this. That's not what I mean. I mean, I need you to have a convex corner. I don't have one in here. but I have this shelf, right? You see, this is a convex corner. There's a sharp edge, right? I'm going to stand in front of that sharp edge and put it right against my back from my tailbone to the crown of my head. My feet are either side of that corner evenly placed and about 3 inches forward of the corner. So once I'm there, I'm going to bend my knees. When I press my heels, I'm going to feel the back is being dragged down that wall towards the floor. I want to do that a couple times. And when you do, you'll feel that the low back is long, the buttock is going down, but you'll also feel your back waist come very close to that corner. It doesn't have to punch into it, but it should feel like it lengthens and spreads with that corner. Then you've pressed the heels, right? So now look at your feet, see that the toes point forward. What do I mean by that? I mean your second toe points straight forward, not your big toe, your second toe. Then you spread the mounds of the foot so you get the kneecaps to lift. And you maintain the length of the buttock down. The arms can just come to the sides. Now, once you've done that, back your feet up an inch or two, get closer to that corner and do the same work again.
When you spread the mounds of the foot, the metatarsal bones should become quite visible.
So that as you continue, you'll feel that A, the buttock descends as your heels press the ground, and B, when the mounds of the toes spread, the knees lift and the thighs press back towards the corner.
Just like you did when you were on the floor.
Then finally, see if you can bring the heels all the way even with that edge of the wall, that corner. And again, bend the knees, slide the buttock down, spread the mounds of the foot, feel the thighs go back. Shoulders roll back too. You can bring the hands to the waist. Feel how your fingers on your frontal hip bones, those bones lift a little. And the thumbs at the top of the buttock, they press down a little. Then just come off that corner and keep that arrangement of your pelvis to your legs. Feel how the legs have to work tremendously to maintain that. And then walk away, but try and maintain that. Okay. Now, get some kind of a chair. It can be a metal folding chair. It can be a chair, just any old chair around your house. Then once you bring that chair back, open it up, if it's a metal chair. Get a brick if you have some bricks. Now, we're going to sit down on that chair, but I'm going to turn now to my right. I'm going to put a brick between my feet. My hips aren't just here, any old where, right? They're way back so that my outer right hip touches the corner of this backrest. Okay? Then again, I'm going to look forward, push your heels down. Push them down, push them down, push them down. And as you do, observe how the flesh of the buttock is going down, similarly to how it was being pulled down, standing against the corner, and as well when you were pushing your heels into the wall on the floor.
Hands on your thighs, inner heels against the bricks.
Now just keep the heels pressing. Feel how even the frontal hip points lift. Maintain that and bring your right hand and then your left hand to the backrest. Pull down to lift the chest up, but keep those heels pressing. Relax the abdomen. Relax the abdomen, and you're turning to the right. Now, you can push gently with your right hand to turn. As well, pull gently with the left hand to turn. Keep those heels pressing. Abdomen relaxed, and allow that twist to come into the lower back. And then with your exhalation, release back to center. Now, I'm going to go to the other side. So just stand up, bring your brick, and go to the second side. So you're going to turn to the left now. My left outer hip touches, heels down. I look forward in order to help train my brain to have that awareness of what happens from within. So I press the heels down, the buttock descends. Then I hold on to the backrest, And I push with my left hand, I pull with my right hand, and I turn. Relax the abdomen, stand in the two heels evenly, turn. Keep the chest lifted. Then exhale, release back to center. Now you're going to stand up and go back to the first side, that right side. Now, I'm going to turn the chair around so that you can see me do from the other direction. So again, I'm going to my right side, but you're going to see me turn away from you. And we're going to talk a little bit about what happens on the back surface of the body. So again, I'm pushing the heels down, the buttock descends. I relax my abdomen and keep those heels down. Then I bring the hands to the backrest. You can kind of pull down to help you stay upright, heels down. I push with my right hand, right shoulder rolls back. Keep the heels down. Now watch. When I pull with my left hand, those back left ribs, this region, I call these thick back left ribs. Watch how they move. They move towards that left elbow. And I turn to my right. Abdomen soft, those thick back left ribs moving. And then I release back to center. Stand up, and we go to the second side. Now, look forward. I press the heels down. And it makes me very upright in my pelvis. So meaning I'm very much on the two sitting bones. The pubic bone, which is in front, and the tailbone, which is in back, are pretty well equidistant from the chair seat. So I'm very upright. Then hands to the backrest. Exhale, push with my left hand, left shoulder back. Now here we go. Pull with the right hand, and those thick back right ribs move towards the right elbow. Keep the elbows a little wide like that. Keep the heels down. And then I release back to center. Let's do that one more time. Okay. Go to your right. One more time. Heels down. Hands to the backrest. Push with the right hand. Pull with the left hand and turn. Heels down, abdomen soft. Lift the chest. And then back to center and go to the second side. Heels down. The pelvis becomes upright. Hold on to the backrest. Push and pull. Pull with the right. Push with the left. Roll those thick back right ribs. Heels down. And then come back to center. Now we're going to stand up and we're going to open up the mat again. We're just going to face the middle of the room. But I have my brick. I'm keeping it on the low height and I'm going to turn it wide. We're going to take Setu Bandha Sarvangasana, but just the first stage. So when I lie back, I want to make sure I'm in the middle of my mat. I press the heels down and a little forward. So again, I get that lengthening action on my low back. Now, when I lift my hips up, I'm going to lift from my tailbone first, as if my tailbone were being lifted to the ceiling. So the buttock is still moving to the back of my knees, really lengthened from the back body. Then I take that brick and I place it right under my pelvis. I keep the buttock lengthening and I set back down so that my sacrum, right, that's not my lumbar spine, the mid-sacrum to the tailbone are on the brick. Then hands to the sides, hold the mat, turn the arms out, get the chest to lift. Take a good little bit of time there so the abdomen softens. You see this whole region hollow and letting go. Then I press and bear weight in my inner heels. So the inner heels just below the inner ankles, bear weight there.
Relax the inner groins.
Keep the hands pulling to the sides so the chest stays lifted. Keep those inner heels down. Breathe through the nose. Now your left leg stays where it is. you're going to take your right leg and begin to straighten it. Now, as you do that, push the right heel away, just like we did earlier on the wall. Push, heel away, heel away. Lift the chest. Now, spread the mounds of the foot on your right. Press the mounds of the right foot away. Keep that chest lifted. Left inner heel down.
As before, this asymmetrical work can bring space into the lower back.
Then bend the right leg. Put the foot flat again. Inner heel's down. Now second side. Left heel's going to slide forward. Push the heel away. Push it away. Push it away. Push it away. Keep the chest lifted. And now press the mounds of that left foot away. Keep the inner right heel down. Breathe. Then change sides. Left leg's bent. Right heel pushes away. Mound of that big toe pressing away. Inner left heel down. Lift the chest. Change sides.
As the straight leg elongates, continue to relax the inner groin and the abdomen while lifting and broadening across the chest.
And then bend both legs. Now, when you press your heel bones down, roll the tailbone up. Lengthen the low back to lift up, and then remove the grip and come all the way down to the ground. Low back should feel long. Now I'm going to take my feet a little wider, so they're almost as wide as the mat. Take my arms out to the sides, right? Then I'm going to drop both knees slowly and steadily to your left. Chest still faces the ceiling. And then exhale, go up and over. You see I'm keeping my feet apart and the knees splay a lot. Knees to the right. Keep looking towards the ceiling. And then exhale, go to the left. And you can just go back and forth a few times here. And with an exhale, change sides. Once the knees are on the side, pause to inhale so the chest lifts. And exhale, go to the other side. Chest lifts. Go to the other side. Last one. Chest lifts. And then come back to center. Now, roll to your side. Get your chair again. We're going to bring that chair right in front of the mat. And we're going to set up for Viparita Karani. To do that, I want you to have a bolster. So, watch carefully. The bolster is going to go right at the edge of the mat. So it's on a sticky mat, so it doesn't move. You're going to move the chair away so you have a little room. So I sit on the wooden floor. And then I put my elbows on that bolster. You see how I get traction? I pull the flesh of the buttock way away from me so that the pelvis is supported on that bolster. My arms can turn out to the sides. I just have to kind of bring that chair in. And I'm going to put my legs up onto that chair seat.
So you can see a little more closely here how I start with the hips on the floor. But I want you to use your elbows, push the bolster, and drag the body back so the hips lift, the shoulders come to the ground, and the upper arm bones turn out. And then just bring the legs up.
For supported Viparita Karani.
So rest here for just a little bit of time. We're essentially treating this pose as a Shavasana pose for this short little yoga vitamin sequence. The pose will transition in a few moments. For now, just rest, relax the abdomen, relax the shoulders, relax the jaw, the mouth, the tongue. Let the eyes close and observe the breath.
Now, use your arms. You're going to start to push that bolster away from you. Push it towards the chair. Let it tilt a little. It's going to have to make room. And then let your back, there we go, come all the way to the ground. So low back should now feel really long. Take the heel of your hand to the very top of your thigh, the top being where it meets your pelvis, okay? Use the hands, push away. Now, you're going to use your hands, grab your thighs and gently, steadily turn the upper thigh and inner groin away from you towards the chair.
If that is not clear, you can see a little more closely here how I use my hands to adjust the upper thigh, to roll the inner groin away from the body and towards the chair. Surrender the hips and the groin and the abdomen there.
You're turning the upper thigh in so that two thumbs roll towards each other, and you just gently press away, allowing the pelvis, the abdomen, the low back to relax. And you can stay that way for a little bit of time if it feels good to you. And then once you feel like that's been enough time, just rest, put your hands on your body, be there for a moment or two. And then roll yourself off onto the right hand side. So hopefully that will help kind of relieve some tension in the back. If you have questions, comment below. I'll do my best to answer any specific questions that come up in regards to this sequence. Okay? Namaskar.